resistant candida like Candida auris, which is harder to treat than Candida albicans. That's made a huge resurgence with COVID, and it is very difficult to treat. Aspergillosis is really common, and it has the double whammy of not only deranging your gut, but being an immune suppressant kind of all on its own. And then if it becomes systemic, you're really in big trouble. So things like that, some fungus that we might not normally think of, they can be they can be key to the gut going way off the rails, but also the immune system going off the rails. So we at least look at those guys. Um, and other things, like I said, that might be obvious to look into, like hormones and toxicants and things like that too.
Right. I'm finding a lot of new infections in people's sinuses actually post this pandemic. For example, say I have a current patient, this happens all the time actually, and I found just mark-ons in their sinuses. We treat it, and then they get COVID. We look at the sinuses. Not only has the mark-ons returned, but then they've got Klebsiella or funguses that they just didn't have before. And I'm finding this commonly now. And I'm thinking about the sinus brain connection and also the sinus lung infection. I'm wondering if you're have thoughts about that.
Yeah. Well, and the sinus allergy connection too.
Right.
Yeah, the best explanation of that, which makes complete logical sense, I've heard, is that because normally the first place that SARS-CoV-2 lands is in your oropharynx, which means it's going to get not only into your mouth and your throat and everything, but also in your upper respiratory passages because you breathe there. It goes, and it's not so much that it actually brings other bugs with it, it's that it settles there in the respiratory mucosa, and then it does this switch with the immune signaling, which your body's trying to fight and do the right thing, but the switch is just far enough that the local immunity, especially in like your sinuses and your paranasal area and your mouth and throat and your lungs, the local immunity then is sort of busy, and it's also imbalanced. So a lot of things, like we should be reinfected with very bad bugs every single day, but because we have immune response, especially in our mucosa, we don't. Well, these people then just become sort of like locally immunosuppressed, and so they breathe in the smallest amount. As you said, mark-ons can come back, but weird things like Klebsiella and fungus and many other things that you wouldn't normally see in an immunocompetent person, they're right there. And I think one of the big problems in treatment has been, especially in the development of long COVID, has been, no one was really thinking that was going to happen, right? And so, we start looking in the obvious places. Okay, pneumonia made a lot of sense early on, so a lot of people were looking there. And then later, GI tract stuff, which is still very underlooked at. But a lot of times, unless you're doing ear, nose, and throat work and you're really into that stuff, infections up there were just like, well, why would that even happen?